Hello and welcome. Today we're going to demystify a pretty complex respiratory condition called bronchiectasis. We're going to break down what it is, how it actually affects the body, and most importantly, the strategies that are used to manage it. So let's dive right in. To really wrap our heads around this, I want you to think about one central question. What happens when the airways inside our lungs just can't bounce back anymore? When they lose that natural elasticity, that springiness? Because honestly, that single problem is at the root of everything we're going to talk about.
Okay, so first up, let's talk about the disruption. We'll start by getting a crystal clear idea of what's actually happening when those airways begin to lose their shape and just don't function the way they're supposed to.
You know, the word itself, bronchiectasis, kind of tells you the whole story if you break it down. Bronch is easy, that's your airway, and ectasis just means dilation or expansion. So what we're looking at is a chronic condition where your bronchial airways get permanently widened. But here's the key part. It's not just that they get bigger, they also become flabby and scarred. And this is where you can really see the difference. On one side, you've got a healthy airway, it's elastic, it's smooth, and it does a great job of clearing out mucus. But then you look at an airway with bronchiectasis, and it's flabby and scarred. Now, why does that matter so much? Well, that structural change is a game changer, and not in a good way. It means mucus can't get out. It just sits there and pools, basically creating the perfect little swamp for bacteria to grow.
In that swamp we just talked about, it kicks off this nasty, vicious cycle. This is really the defining feature of the condition. See, the airways get damaged, so secretions start to pool. That pooling leads to infection. The infection then causes more inflammation and damage, which makes the airways even wider and more scarred, and the whole cycle just repeats itself, getting worse and worse each time.
Okay, so now that we understand this internal cycle of damage, let's move on. What does this actually look and feel like for someone living with it? We're calling this section the fallout, and we're going to dig into the signs and symptoms.
I want to give you a number that really paints a picture of the daily reality here. 200 milliliters. Now, what does that mean? That's almost a full cup of thick, purulent sputum that someone might cough up in just one episode. I mean, that's a really powerful way to understand just how much is going on inside those lungs. And that leads us directly to the most common symptoms. You got that persistent, productive cough. We just talked about what that can produce. You get those recurrent infections over and over again. And then there's the shortness of breath, what doctors call dyspnea, which can happen with even the smallest amount of effort. If a doctor listens to the lungs, they're probably going to hear things like wheezing and crackles too.
And this isn't just a lung problem. Over the long haul, the effects can actually start to spread. If the disease is really chronic and widespread, you might see physical changes like clubbing of the fingers. It can even put so much strain on the heart that it leads to right-sided heart failure. There's a medical term for that, cor pulmonale.
So you might be wondering, how do doctors figure all this out? How do they confirm it? Well, that brings us to our next section, the investigation. We're going to look at how it's diagnosed and the hunt for the root cause.
The whole diagnostic journey usually kicks off with a chest x-ray. But a heads up, it can sometimes miss the disease in its early stages. The real heavy hitter here is the CT scan. That gives a much more detailed picture of those widened airways. And another crucial piece of the puzzle is a sputum culture. Why? Because it tells you exactly which bacteria are causing the trouble, and that's absolutely critical for picking the right antibiotic.
Now, this is a really important point to get. Bronchiectasis usually doesn't just show up out of nowhere. It's almost always a secondary condition, meaning it's the result of something else. That could be another chronic respiratory issue like cystic fibrosis or asthma, or maybe a past infection like TB. It could even be caused by a physical blockage in the airway, and there's even some research pointing to things like a vitamin D deficiency playing a role.
All right, let's shift gears to what is probably the most important part, the strategy. What can be done about it? We're going to walk through the treatment playbook, and you'll see it's a really comprehensive, multi-pronged attack.
You know, the whole treatment strategy really comes down to three main goals. It's that simple. Goal number one, and this is the big one, keep the airways clear of all that gunk. Goal number two, control and prevent those infections from coming back again and again. And goal three, if there's an underlying problem causing all this, you've got to try and fix it. Pretty much every treatment we're about to see ties back to one of these three things. And this chart here just lays out the whole toolkit so clearly. To fight infections, you've got antibiotics and, of course, preventative vaccines for flu and pneumonia. To help open up the airways, that's where bronchodilators come in. To get rid of that sticky mucus, we're talking mucolytics and chest physiotherapy. Then you've got corticosteroids to bring down inflammation and oxygen therapy for extra support when breathing gets tough. It really is a full-on assault on the symptoms from every angle.
Hey, let's break down another one of those medical words, mucolytic. It's just like before. Muco means mucus, and lytic means to break up. So these are literally mucus breakers, and some of them are pretty clever. For instance, some of the inhaled ones are basically a type of sugar that draws fluid into the airways, which helps liquefy all that thick mucus and makes it way easier to cough up and clear out. Pretty smart, right?
Okay, so let's get to our last section, what I'm calling the long game. Because this is all about shifting from clinical treatments to the practical day-to-day stuff. It's about building a personal toolkit for managing your own breathing and just feeling better.
And I have to stop on this point because it is so important. When we talk about shortness of breath, dyspnea, the best way to measure it isn't some fancy machine or a number on a chart. It's what the patient says they're feeling, their own words. It just goes to show how crucial that partnership is between a person and their healthcare team. So what can you actually do in the moment when you're feeling breathless? Well, there are 3 simple but super effective things to try. First, just sit upright. That helps your lungs expand. Second, there's a neat positioning trick called good long down that can actually improve your oxygen levels. And third, pursed lip breathing. It's a fantastic technique for helping you relax and get rid of that built-up carbon dioxide. And here's your non-prescription toolkit, the stuff you can do at home to keep those airways clear. Number 1, and this is huge, stay hydrated. Drinking plenty of water thins out secretions from the inside. Just keep moving, even gentle movement helps get that mucus on the move. Also, practice controlled coughing. Taking a deep breath first makes your cough way more effective. And hey, even a simple humidifier in your room can make a real difference.
Last but not least, let's talk about pacing yourself. This is so crucial. When you have a chronic breathing issue, literally everything can take more energy. Even talking or eating a meal can be exhausting. So the biggest takeaway here is to learn to pace yourself. Taking breaks and building rest into your day isn't a sign of weakness. It's actually a super smart strategy for managing the condition long term.
And that really leaves us with a big question to chew on, doesn't it? For a chronic condition like this one, something you live with every single day, is that daily playbook, the hydration, the breathing techniques, the pacing, is that ultimately even more powerful than the prescription you pick up at the pharmacy? It's just something to think about. Thanks so much for joining me.